Today we'll be talking about depression, anxiety disorders, and bipolar disorders, so let's get started. Mental health involves our psychological, emotional, and social well-being. It helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life because your mental health can change over time depending on many reasons. Your mental health is important because it's a component of your overall health. When you don't take care of yourself, it could lead to health issues in the future. These are some ways to maintain positive mental health to prevent that. Mental illness, also known as mental health disorders, refer to a wide range of mental health conditions. Many factors can contribute to a person developing a mental illness at some point in their life.
Some research on mental illness and disorders. More than 50% will be diagnosed with a mental illness or disorder at some point in their lifetime. Anxiety disorders are the most prevalent psychiatric problems among college students. 1 in 25 Americans live with a serious mental illness such as schizophrenia, bipolar disorder, or major depression.
The prevalence of mental health is significant among the U.S. population. Here we have two graphs based on individuals' gender, age, and race or ethnicity. Graph 1 on the left portrays any mental illnesses, and Graph 2 on the right portrays serious mental health illnesses.
What is depression? Depression is a mental health disorder that is prevalent among college populations. Seasonal affective disorder. Patients typically experience depression in the winter months when there is less exposure to sunlight. Clinical depression. Major depressive disorder, common but serious mood disorder. Statistics on depression. This graph represents students with depression during academic term during COVID. The bottom graph to the right is depression was higher in females and between age gaps 18 to 25. Important facts. Depression is a common but yet very serious mental illness. Depression can affect anyone, and women are 70% more likely to experience depression than men.
Symptoms include feelings of sadness, tearfulness, emptiness, or hopelessness, the lack of interest or pleasure in most or all normal activities, reduced or increased appetite, feelings of worthlessness or guilt, trouble thinking, making decisions, and frequent or recurrent thoughts of death. Treatment can be psychotherapy, medications, and neuromodulation. And lastly, resources colleges can use to address depression could be grief support groups, nutrition and wellness centers, online therapy, pet therapy, and recovery houses.
Anxiety. What is anxiety? Well, anxiety can be described as the body's response to any external or internal situations. It usually occurs when individuals are confronted with dangerous or challenging situations. Anxiety can cause feelings of restlessness, hyperventilation, and excessive sweating. Here we have some symptoms of generalized anxiety disorder. These symptoms include restlessness throughout the day, susceptibility to fatigue, experiencing difficulty in controlling emotional feelings such as worry, and difficulty in sleeping correctly, having unsatisfying sleep, or even falling asleep.
Some treatments for anxiety include psychotherapy, which involves working with a therapist to reduce your anxiety symptoms. There is also cognitive behavioral therapy, which is the most effective form of psychotherapy for generalized anxiety disorder. Cognitive behavioral therapy is generally a short-term treatment that focuses on teaching you specific skills to directly manage your worries and help you gradually return to the activities you've avoided because of anxiety. Through this process, your symptoms improve as you build on your initial success. Medications include antidepressants, Buspirone, which typically takes up to several weeks to become fully effective, benzodiazepine, which is a sedative generally used only for relieving acute anxiety on a short-term basis.
Something notable about anxiety disorder is the fact that it's one of the most common mental illness among the American population.
What is bipolar disorder? Bipolar disorder is a mental illness that centers on the inability to manage emotions effectively. Individuals who suffer from bipolar disorder experience extreme mood swings. Manic episode symptoms are increased energy, extreme euphoria, and risky behavior. Individuals can experience depressive episodes which can look like feeling hopeless or thoughts of suicide.
Bipolar disorder was found in 15% of adolescents. Borderline personality disorder affects approximately 0.7 to 5.9% of the general population. 70% of individuals experience their first symptoms before age 25 with peak onset at age 17. Roughly 3.2% of college students meet the criteria for bipolar disorder. Bipolar disorder can decrease an individual's chances of completing college. Up to 50% of individuals with bipolar disorder will attempt suicide at least once.
The effects of bipolar disorder in college include trouble focusing, stress triggers, and insomnia. Treatment for bipolar disorder include medication, psychotherapy, and ancillary treatment. How to find support for mental health in college. There are multiple on and off campus resources. An important resource at UH is CAPS. For more information about CAPS, you can visit their website or visit the on-campus location at Student Services Center 1, room 226.
But it's out of my control. You'll be left in the dust unless I stop by you. You're a sunflower. I think your love will be too much.
What are some good tips for managing mental health? Some sufficient ways for dealing with mental health include getting enough sleep, practice a healthy diet and keeping yourself active, try to avoid drugs and alcohol, practice mindfulness, and surround yourself with a good support network.
In conclusion, mental health has become a much more widespread topic. The mental illnesses we've discussed are just a few that can be exhibited mentally and physically. With early detection of these illnesses and a proper treatment plan, people can be able to overcome these obstacles.
Thank you for watching. We hope that you learned something new about mental health and use the resources we listed if needed.